We will get going with the Improving Post-Acute Transitions of Care Management featured panel today. Again, I'm Steve Rottmann, and it's my privilege to moderate this afternoon's discussion that includes Advocate Aurora, Leading Choice Network, and Bamboo Health. This panel is sponsored by Bamboo Health. Bamboo Health delivers real-time care intelligence solutions that are compatible, accessible, and built on the most powerful care collaboration network in the country. A WISHIN partner since 2018, Bamboo Health provides clinical support and visibility into patient events, helping healthcare organizations, professionals, and others improve outcomes, reduce total costs of care, and succeed in value-based care programs. Thank you to Bamboo Health for sponsoring this session. On this panel, I am joined by Gina Lemmenes, Holly Kimps, Lauren Davis, Matt Berg, and Chris Meehan. I invite each panelist to please introduce themselves, the role in their organization, and opportunities that are at the forefront of this multi-stakeholder collaboration to manage and coordinate care for post-acute patients. We'll start with you, Gina.
Good afternoon. My name is Gina Lemmenes. We'll get that straight, first of all. So
Thank you.
I am the manager of Advocate Aurora's Post-Acute Network program for Wisconsin. And I think the opportunities that Aurora is looking for within this collaboration is really to cost-effectively manage our short-term rehab patients, our ACO patients, across the continuum, from anywhere from the hospital to the SNF and as they go home again.
Hello, I'm Holly Kimps. I'm the program manager for Advocate Aurora's Post-Acute Network. My role is really to work with the SNF leadership and Leading Choice to ensure smooth transitions of care and to elevate the quality of care within the skilled nursing facilities.
Hi, good afternoon, everyone. I am Matt Berg. I am the CEO of Leading Choice Network. We'll talk a little bit about Leading Choice Network here, just to give you an overview of the organization, as I imagine we might be new to many folks out there. So Leading Choice Network is basically a big group of nursing homes, assisted livings, and even independent living communities all across Wisconsin. Our mission statement is to align services to improve the delivery of care in partnership with health plans and health systems. We are a cooperative model, meaning all of our member providers actually have equity in the network and are actual owners. So we're like a membership organization on steroids. We're really big. We have 51 member organizations. We have 67 nursing homes across Wisconsin, and then about 130 senior housing communities, and a couple home health as well. Our entity is called a financially and clinically integrated network. What that means is the board made up of our member organization CEOs can push out, approve, and then we push out certain clinical protocols that everyone in the network is required to follow. And what that does is that gives me antitrust compliance to be a power of attorney to act on behalf of everyone in the network. So even though we're 51 member organizations, we can all act in one in our activities of partnering with health plans, and then in this case, a health system. Really, we're all about trying to participate in alternative payment models. We have quality requirements to become and remain a member. And so we're all about providing quality of care, but nursing homes haven't really been able to participate in alternative payment models and these value-based cool contracts that many of you are doing. So a big purpose for us is we're already providing the quality of care, but we need to measure it and show our health plans and health systems that data and show the quality and the impact that that has, and then put in contracts in place that incentivize that quality of care. And then the goal is then that we can grow and kind of expand that model of providing good quality nursing home care, which we all know that we need in Wisconsin. The slide you can see here is a little bit more about our specific relationship and work that we're doing with Advocate and Aurora. So this started earlier this year, but we've been working on this for several months, almost a year now. We have, of our 67 nursing homes, about 30 that are in the primary region that we're working most closely with in the project that we'll be talking about today. I'll pass it off to Lauren.
Thanks, Matt. Good afternoon. My name is Lauren Davis, and I'm the clinical advisor for Leading Choice Network and also the CEO of Davis Clinical Consulting. My role within Leading Choice Network is being that clinical component and really working with the members and being the boots on the ground, having been in long-term care for my nursing career, really understanding operationally how we can implement different technologies, different evidence-based best practices to help be better partners for health systems and payers. I'll keep mine short.
Welcome, everyone. My name is Chris Meehan, Growth Director here at Bamboo Health. Steve highlighted a little bit what we do, but our mission is to transform lives during pivotal care moments. In my role specifically, I focus on ensuring that our partners in health systems in the Midwest are getting the most value out of our products and our network. So I'm really honored to kick things off today. I think what this group came together as a health system, a group of skilled nursing facilities, and a technology vendor with one goal in mind. We talked about it this morning. It's all about the patients. And collectively, how do we provide the most cost-effective quality care? I'm really excited to celebrate over the next 49 minutes or so with this group. We're going to celebrate our wins to date and the strides we've made, and we look forward to a bright future. Thanks.
Thanks, all. We will start the questions knowing the importance and keeping in mind the critical nature of hospital and post-acute transitions play in the care and delivery of services to those aging and most vulnerable patients. So if I might ask the whole group, and we'll start with you, Gina, what is the genesis for this stakeholder group to come together?
I think the genesis really is we had a program, really a CMS, a nationally recognized program for post-acute, our post-acute partners for the last 16 years in Illinois. Once Advocate and Aurora merged, they felt that the need for the Wisconsin, state of Wisconsin, to have this program as well. So, with our current model, we are leveraging individual relationships with these SNFs and securing an agreement, engaging an APC and a SNFist, if we can get them, employed to really follow our patients in the nursing homes. And we also provide a nurse, which is Holly, a program manager, to follow those patients as well. As you can see, it's very not very cost effective to have this kind of model. On top of it, with our population of attributed lives is kind of scattered over Wisconsin, and we've had some difficulty with getting patients to our skilled nursing facilities. The public health emergency was one of them. We've had closure of units, closure of SNF beds. So the availability wasn't there. So we really had a challenge getting our patients to the SNFs. So especially to our network of SNFs. So we kind of had to think outside the box. How are we going to reach more attributed lives across the continuum, across the southeastern part of Wisconsin? So, we had some hybrids of the model, and we were, looking at different ways of doing it. And then we came across Leading Choice. And with their network, we're able to, it's cost effective, obviously, We can see more patients. We can follow more patients. We have obviously limited resources, as well as the SNFs, and we need to explore how to improve upon the number of patients that we touched to make sure that we were following our ACO patients, we were managing their cost of care, and we were delivering them back then, after they left the SNF, back to our Aurora partners, our physicians, to make sure that, we were taking care of them well.
Thank you, Matt. Anything to add about the value that Leading Choice Network can provide at a high level?
Yeah, you bet. So it's a great question. How did this partnership come about, and you, kind of what is it, and what is the value we can provide back, and they to us, of course. We're interacting with a lot of health systems, but we're a small group. We've got limited bandwidth, and one of the reasons that we were so impressed with the approach that Advocate Aurora was taking is they basically came to us and said, we are recognizing this dynamic of an increased demand and a decreased supply, and they said, how can we help? And basically said, let's collaborate on a solution. And that was so cool. We said, yes, absolutely, we want to do that. And so some of our pain points as we're listening to our members is a lot of our members are saying we're working with usually 3-4 big health systems. They all have different systems, workflows. We do X, Y, and Z for one group and ABC for another. It would be so great and efficient if we could just do that same set of workflows and reporting for each of them. And we introduced that concept, and they were open to it. So we said, that is awesome. That is the opening that we were looking for. So for us, a huge value to this was about staffing efficiencies. We are running at low census these days, usually 70 to 80%. We've got a lot of empty beds. And the key to get higher census is staffing, of course. So we're all looking for staffing efficiencies. So a big part of what we're going to talk about today is how can we use Bamboo and work together to create some staffing efficiencies, and we'll tell you some good examples of that. But also, we want to work better with the hospital to provide better care to the residents and really reduce the cost of care too. So what does that mean? That's implementing communication systems, feedback loops, and automating those so we can take that staff time and put it towards basically patient care. Also for us, more referrals, that's also a really good thing as well. We're always looking for that too. Maybe Laura, do you want to talk about kind of what it is that we're working on? How does this relationship look?
Yeah, thanks, Matt. So what we did with our members, we're starting with a small pilot, specifically in the Milwaukee and surrounding areas. And we worked out an MOU with Aurora that lists out specific things that from a clinical and operational standpoint, our members had to comply with. One of those was enrolling in Bamboo and having that technology available to help Aurora be able to track their attributed lives through their ACO throughout our system and throughout our members. So we wanted to make sure that when a patient came to us from a hospital as a referral, we would know if they were attributed to what hospital and what that looks like, and how would we indicate in our EHRs, since the interoperability of EHRs is not totally integrated at this point. But the future, and being able to then show where is that patient ACO-wise, and upon admission, are we giving them to the Aurora provider? Upon discharge, are we setting up the right provider for their follow-up appointment, and being able to capture potentially transitional care management systems and things like that. So from our member standpoint, it's really just ensuring that they know who is in the ACO, and they do that through Bamboo.
So Chris, I'll hand it off to you. From Bamboo's perspective, what are the quality and cost efficiency aspects that Bamboo provides to the ACO itself?
Yeah, I think two things I'll highlight. One is the identification. So we talked through this with the Aurora team, and I'm sure Holly and Gina are going to expand upon this, but the identification of that this is an Aurora ACO member is really significant. Oftentimes, the patient doesn't go from an Aurora facility to a skilled nursing facility. It can go from, anywhere on this care continuum to that skilled nursing facility, and you might not have any line of sight that this is an Aurora ACO patient or this is an attributed live from another health system entity. The other thing is the communication. How do we kick off that communication mechanism? And oftentimes it is through that identification that they can start collaborating directly with Aurora, talk with their care teams, know who to talk to, and start that process so that ultimately as this patient gets ready for discharge, you're discharging at the right time, at the right place, based on their care journey.
I'll go to Holly. Holly, how do you foresee the patient outcomes improving through this hospital and SNF collaboration?
So there are quite a few benefits for patient outcomes that can come out of this collaboration. One of those is improved care transitions. So having more transparency through identifying where our patients are throughout the care continuum, whether it's, like Gina mentioned, from the hospital to the SNF, another healthcare system to the SNF. So definitely improved care transitions through enhanced communication. Like Chris mentioned, identifying our patients and then being able to communicate with the right people. And then overall having decreased readmissions. One of the big things with Leading Choice was that their quality standards really aligned with our quality expectations as well. So there is that sort of like trust relationship with them that they will continue to work to reduce readmissions for the patients, as well as implementing best practices across the whole market. And then also, that leads into standardizing the nurse best practice for the partnered SNFs. So that's really awesome.
Really, one of the other outcomes is managing our length of stay for our patients in the nursing homes. When, the ACOs are really on the hook for the cost of care. So we want to manage that length of stay in the facilities. We're partnering with them. They're understanding what our goals are, and they're working towards those. She talked a little bit about readmissions, and one of Aurora's big initiatives is our TCM follow-ups. They've kind of been proven to show that if you get that patient back in and they have that transitional care management follow-up with their physician, we make sure that they have the correct meds, that they have their correct diet, they have what they need to be successful at home. So we're not, they don't go home and they don't know what they're supposed to do and they don't have their meds. How are we going to get them? They end up going back to the ED then, and then they get admitted because they hadn't been taking their meds and nobody's been watching them. So I think that was one of the big outcomes as well,
That in that TCM appointment number for us, that is such a key figure, and it's so underutilized. We did this big report through WHIO, which showed that only about 3% of all of the people that came through our 67 nursing homes had that TCM appointment with their physician. And I think Gina's got some numbers, but there's a direct correlation between readmissions and actually having that TCM appointment take place. So honestly, there's a lot of really seemingly low-hanging fruit that we could work on in a partnership with the health system and a big provider group.
And what's important about that is if the appointment is made, we have data that shows that over 90, I think it's like 94% are actually showing up for that appointment, which is huge for that readmission reduction.
Anything else to add from the ma'am? Okay, Lauren?
Yeah, I was just going to add some. So we had talked earlier about having that clinical integration and those evidence-based best practices. So Leading Choice Network as a whole has been working on readmissions since the inception of our network. And our network comes to Aurora with lots of good programs already in place, which then we can collaborate with them to just continue to improve them. But we're talking about the TCM appointments, and our facilities are currently making discharge follow-up phone calls as part of one of our readmission strategies. So that was rolled out a couple years ago where every member being discharged from one of our communities is getting these follow-up phone calls. And so being able to collaborate with the hospital system, share data, and be able to ensure that our patients upon discharge are having the appropriate discharge plan components actually set up, such as medications or having that follow-up appointment, it just adds another layer of ensuring that compliance from those members.
It's the efficiency part of it too. We're not duplicating services. You know, your staff was calling and calling, you know, I think you'd said a couple times upon a discharge of a patient, you know, so could they rely on the information that we have in Epic to see, oh, okay, they do have that medication, they do have their DME, they do have all the things that they need to be successful at home. So a lot of it on efficiencies as well.
So let's stay there just for a little bit. And Matt, Lauren, please describe the additional improved experience that SNFs are experiencing with gaps in data available that would prevent readmissions back to the home or then follow-ups into a hospital, and also maybe manual data entry burden or accessibility to data?
Sure, I'll take it.
Okay. So from the data accessibility standpoint, I think with our members having that data available through Epic CareLink is really key. I think there is always room for improvement and opportunities to have even more data shared between the hospital system and the facilities or the skilled nursing facilities. But I think that with having those partnerships and their Epic CareLink access to all of the Aurora hospital systems, it just allows for more visibility of where that patient is.
And yeah, it's really all about staying in network. So especially for the ACO, that's such a big deal, reducing leakage and seepage, I've heard it called. But you know, surprising number of people, I think Holly's got a statistic of people that are in the ACO actually come from non-Advocate and Aurora hospitals. And so if we're able to capture them and then get them back in network, so they're going back home with Advocate and Aurora clinicians with home health or what have you, whatever, you know, post SNF discharge, well then obviously, of course, that's going to have a pretty big impact on the readmission rate just from the better care and coordination that comes from that.
So we found that actually 33.7% of our ACO patients were coming from out-of-network hospitals. And as our program, our post-acute network, as it stood, was only able to capture 13.8% of those patients. So this partnership really allowed us to capture that many more patients.
And just very, very simply, just to walk through the very simple kind of mechanics of the communication flow. So when we get a referral because we're set up with Bamboo, anytime we accept somebody that is in the Advocate and Aurora ACO, we have it set up where we get an automated email. It says, hey, heads up admissions person, you just took somebody with that's in the Advocate and Aurora ACO. So we say, okay, good to know. Then we just then help make sure that they're staying in network. Very simple. But really effective because there's a surprisingly large number of people that are not being captured.
I would say, just to break things down to make this as simplistic as possible, to expand upon what Matt said, we have connected entities across Wisconsin and beyond Wisconsin that are all contributing ADTs and rosters of patients. So that when a patient on one of those rosters has a care event, everyone on the care team is aware of that event. So from a SNF perspective, Matt can look up and understand that this is an Advocate Aurora patient. He can look up some additional clinical context on that patient to ultimately align on these quality metrics that have been preset by the team and work in collaboration with Aurora on the discharge and quality of care.
And that's exactly what I was going to say, that Bamboo sends me then the feed and I'm able to identify where my patients went. And then from there, I can track and trend things such as like is a facility having issues with falls? And then we can work together as a team to determine what we can do to increase that quality at the facility.
So Gina and Holly, can you share how the multi-stakeholder engagement has driven process improvement and awareness between Advocate Aurora and its PAN-SNF members? And I will just add another question then to Lauren and Matt regarding the importance of additional data that might be available for bringing those folks into a specific facility and helping those patients make a decision based on the information that might be otherwise available.
Yeah, so as we mentioned, our program's focus is really on improving those care transitions, whether it be from the hospital to the SNF to the ambulatory care. So this multi-stakeholder collaboration really minimizes the risk of complications within those care transitions and reduces the risk of those costly readmissions due to fragmented care, as we talked about, reducing the duplication of work through that enhanced communication and care coordination it provides. The use of technology and sharing those medical records has been a key component with this collaboration, and our goal is really to gain access to the patient chart, providing an up-to-date plan of care and patient health status. Another key component is having specified contacts for the leading choice facilities as well as Advocate Health, because we are really rather a large health system, so having a point person reduces that daunting task of knowing who to call when there is a concern or something that is needed. And as well, likewise, for leading choice with, rapid turnover in the SNFs, just being able to connect with one person makes communication that much better. So overall, it just really increases the amount of communication between Advocate and the skilled nursing facilities.
A really good example, I think, of our work together so far can be found in the 3-day stay waiver contract that we've signed between our two groups. So all of those 30 nursing homes we all have 3-day stay waiver contracts with the ACO, meaning that anyone in the ACO can skip that 3-day qualifying stay at the hospital and go directly to a nursing home. So that is a huge factor that I'm sure Gina and Holly can talk to about reducing hospital admission stays, but also it's a pretty big factor for the resident too, or the patient, that they don't have to go through maybe such a high acute setting if they don't have to. But for us, the communication systems that we've got in place with Bamboo and interoperability is such that while we do get the Advocate and Aurora discharge staff that will flag it and say, hey, heads up, nursing home, this is a 3-day stay waiver person, we then also have the ability to double check that. So we can go onto Bamboo, we just do a quick search, make sure, yep, that person is in the Advocate and Aurora ACO, they qualify, we're on the hook for that payment. We then can be assured that, yes, this is a double check and we're comfortable taking that person and knowing that we're going to get paid correctly for it.
And I think it's a win because we have 30 extra nursing homes now that we can send these 3-day waiver patients to. Obviously, to reduce the bed capacity in the nursing homes, in the hospitals, it's a win-win for everyone. It's really a win for the hospital. We can send them from the ED as well. We've done that to nursing homes. It's a win for the nursing home because they can bill Medicare then for that stay that may have not been covered. And then it's a win for the patient because they don't have to self-pay and they can get the care that they need. Obviously, then, a lot of the patients that we get from the ED are those that are just failing at home, are weak, can't ambulate. Can we give them some therapy for a short time, get them back home and have them be in their home setting and do better? So the 3-day waiver, they have their process in place to make sure that they're in the ACO. We have the same thing. We're making sure that we're following all the rules and regulations for those patients. So kind of a double check so that the nursing home gets paid. Because if we send a patient there and they're, we don't have our boxes checked, they may not get paid, but they've got their double check as well. So It's a win for the nursing homes. It's a win for the patient and the hospitals as well.
And while we've been spending, a good amount of time, several months on this now, we're really just getting going. There's all kinds of really cool things that we're looking forward to doing. And one example of that is related to this. So length of stay, we're all trying to work on length of stay. So we're going to send somebody home and they say, oh, I'm not so sure, but let's give it a try. And we can collaborate closely with the advocate home health, and they can say, well, this person's not super confident, so let's watch them closely. We get a call a day later. They say, hey, something happened. I don't feel good. I need to go into the ER. And they can say, you know what? You don't have to go to the ER. You can go back to the nursing home. We're all set up. And you can just imagine that the system as a whole just benefits from that kind of collaboration.
And just to add as well, with Leading Choice Network, when partnering with Leading Choice Network, it's going to work the same across all of our members. So we have that one-stop shop approach. And as we're rolling out these protocols or different education, all of our members are receiving that same education and the same tools and resources to help these items be operationally effective. And when there's leadership transition or turnover, we want to make sure that these things continue and helping ensure that the technology continues through those transitions. I don't know how many times we've heard that they don't, new DON or new director of nursing and nursing home administrators start and they didn't know they were signed up with Bamboo, or they didn't know they were in the Aurora ACO PAN program. So just making sure then as those transitions happen, we're able to continue these processes utilizing our Leading Choice team.
Chris, I'll look to you to answer this one. What can the SNFs hospital and hospitals experience now that the future through Bamboo Health offers this care coordination platform and alerting in real time?
Yes, Steve, I bucket that into two things. One, product. So we continue to iterate on delivering this in the right mechanism to really drive those outcomes. So from a product perspective, we need the right data at the right time to drive the right outcomes. And that involves delivering it at the right capacity. We, as Bamboo, we continue to get more upstream. We want to be predictive of who's going to be a high utilizer, who's at risk to be a high utilizer. How do we analyze the data to put clinical strategies in place based on the historical patterns of patients? And then lastly, from a product perspective, we want to improve the way we deliver the information. So from a Bamboo Health perspective, we have this great data set, admission, discharge, and transfer feeds. But what we don't have is what WISHIN has to offer. So WISHIN, we talked about WISHIN Pulse, we talked about 2.0, but what we're doing is embedding a single sign-on directly within Bamboo Health. So what that's going to do is provide additional clinical context that you might not have from the admission, discharge, and transfer feed, to ultimately have that context on the patient to hopefully derive a better outcome and have more transparency of where this patient's been to make, better prediction on the future. And from a network perspective, I think this goes hand in hand with products. So from a network perspective, we continue to invest in this network. We talked a little bit about how it's evolved specifically in Wisconsin this morning. We continue to get more hospitals and we continue to get more SNFs. So what did that do for an ACO? From an ACO perspective, we need visibility into those care events. And by having additional buildings on Bamboo Health, Aurora now knows our patient got discharged from Pro Health and now ends up at a different SNF. Or maybe when they are sitting at Pro Health ED, we can potentially work with the Pro Health team and get them back in network to our Leading Choice partner. But this is all done through having that visibility, across the network, and the collaboration with both Bamboo Health and WISHIN, and our collaboration with sharing data and having a joint network has been really effective in that capacity.
Appreciate that, Chris. And WISHIN is pleased to be part of the solution in driving those ADT messages to the network. That's driving a lot of the value and efficiencies throughout this program. Going off script a little bit, the efforts to close the gaps. So we don't have everybody, is my understanding. What are the efforts and how can we continue to partner together to close the gaps with SNFs in the network, hospitals not in the network, and any additional other resources and data exchange that might improve this, taking it to the next level?
Yeah, I think it starts with having these conversations that we've had with Leading Choice, that we've had with that Advocate, about how do we prove our value and understand how progressive organizations use these tools. And I think that's what we Leading Choice has come to the table and been very collaborative in understanding of what the tool offers, how they're clinical partners, and how can Leading Choice ultimately be an extension of Advocate's care team. That's a really powerful statement. And the Leading Choice is an extension of their care team. They use the same technologies. It can ultimately collaborate and drive based on these outcomes that you've established. So it's having a technology, not necessarily be the end all be all, but it's a change mechanism that ultimately keeps the red thread between our three organizations together.
For us, is that identification of the patients and the effectiveness or the efficiencies that being partners with all of them provide for us. I can't say enough about what we had in the past as to where we're going now. I think it's kind of revolutionary, and there's a lot of trust here. So in our past program, we really we were kind of more embedded. We were kind of in the SNFs, daily lives, and they were kind of like, maybe we don't want this. And with Leading Choice, it's that trust that we have with them, that they're providing the quality care that we need for our patients. They're partnering with us with our expectations, so that we can make sure that we're meeting the needs of our patients, we're meeting the needs of our ACO patients, and taking care of them well.
So yeah, for example, that's great. Thank you, Gina, for saying that. And yes, we agree that this is kind of revolutionary. We're just getting going, but the sky is the limit on the many initiatives that we can do and the quality that we can improve on. One great example, speaking of that, Lauren will talk a little bit about how many stakeholders we have coming into our building and the relationship that we have built with Advocate and Aurora and how that works with us. But I think Holly and Gina would use the Bamboo data, see a trend, and then can pass it off to us. And then Lauren can talk about what that would look like in the two different kind of ways with the stakeholders that come in all the time versus what we hope to be doing or what we are doing with Advocate and Aurora.
Yeah, so current state outside of the Aurora network. So there's hospital systems and payers that'll come into our building to weekly Medicare meetings. And at this meeting, we talk about length of stay, we talk about discharge plans and goals, and we manage the length of stay as the skilled nursing professionals in long-term care. So we work with our therapy team. We have the whole interdisciplinary team involved in those meetings. All of the, well, I shouldn't say all, but some payers and health systems will send in individuals, or they will have people call in virtually to babysit that meeting and be involved with that length of stay discussion. Like Gina said, it does get very complicated. There's a lot of different things we have to do to coordinate all of that, specifically if there's potentially 8-10 different outside organizations who want to manage maybe their one patient or their two patients in that meeting. So it becomes very complicated. And what we've really appreciated with the Aurora team is they've given us that ability to manage those patients and manage length of stay. Now, in a situation where Aurora might say, hey, your length of stay for your sepsis DRG codes is elevated, higher than the average or higher than what we want to see, then what they can do is work with the Leading Choice Network. We can create tools, collaborate, create tools and protocols that our facilities can then initiate to help reduce those overall measures. But I think, from a staffing, and we're talking about efficiency and shortages of staffing, to send individuals into 67 nursing homes to manage length of stay may not be the most effective use of time. But relying on partners and professionals in each of those care areas can really help make that process more efficient.
And again, I will ask one off-topic question or unscripted question before we then open it up to any questions. So if you do have questions for the panelists, please raise your hand and ready for that, and we'll have a microphone come along. That question, again, off script, WISHIN looks forward to playing a larger role. And intentionally, we had these panelists come up not for a commercial about WISHIN, about the work that we enable in the background, that all Leading Choice, Advocate Aurora, the facilities, Bamboo Health benefit from providing this service. But as we look forward in additional connections and into post-acute facilities and hospitals, what do you think a role for an HIE might be throughout the ACO and across the state? Maybe a larger question for Leading Choice Network there. But Gina, please. Or Holly.
Yeah, I was going to say, as Chris mentioned before, obviously Bamboo has great information for identifying our patients, but then there are the limitations of finding information further about them. So what we foresee WISHIN being able to provide in the future is partnering with the SNFs and allowing us access to see what the plan of care, what the medication record, et cetera, is from the SNF side, where currently we don't have access to that. So I see that being in the future.
Actually, when we were getting ready for this panel discussion, we started bouncing ideas off of each other as to what WISHIN could do for the SNFs, what WISHIN can do for the hospitals, and we've already started a list, Steve. So we maybe bring that to you in the future.
We'll ready ourselves. Any other comments?
Don't give away any trade secrets. This is all off the cuff.
All right. Well, thank you again. Let's open it up to questions in the audience here.
So can you talk a little bit about how this would be handled with a small rural independent hospital, and then also how to make it affordable? If you do not belong to an ACO or you do not belong to an organization?
I think Leading Choice can tackle the first one, and then affordability, I think, Chris, right? Yep. So that's a great question. Thank you for asking. My background is in representing a cooperative of all rural Minnesota providers. So rural is a passion of mine, and yes, they need attention. We all need rural providers, really, really bad. So our goal with this is we want to create a system of how we're working with Advocate Aurora and be able to replicate that with every single other hospital and health system out there. So like I mentioned at the beginning, we're trying to create a unified system of workflows and reporting that can work for Advocate Aurora or a small rural hospital. It's the same thing. We can say, nursing home X, you're doing X, XYZ process for Advocate Aurora. You can do the same thing for the discharges with this certain hospital. So yes, that's a huge goal of ours. And Advocate Aurora has been really a great partner in helping us modify our workflows to be sort of agnostic to the hospital referral source.
I would say from an affordability perspective, the needs of Advocate are going to be different from the needs of your rural community hospital. So I wouldn't necessarily think we would need this whole tech stack in order to have a collaboration with Leading Choice to ultimately drive some of these outcomes and like to understand when your patient goes elsewhere. But I think, and you maybe can speak to this a little bit, you're concerned about understanding when your patient leaves your facility and goes to the SNF and having that collaboration. Is that fair? Yeah. And so it's not necessary. Some of the tools in the workflows that Advocate has for their ACO are going to be a lot different from your rural hospital. So it's a different approach. I think it's a collaborative approach, and we want to put the right technology, the right processes to ultimately drive to those outcomes.
Yeah, I'll add that WISHIN sees, and that's why I asked a question about a larger statewide initiative. this is the focus right now. Let's do this pilot the right way. Iron out all the kinks, understand what areas of improvement need to be made, and where WISHIN and a Leading Choice and Bamboo Health can take this throughout the state of Wisconsin. There are other ACOs that are longing for this type of collaboration and cooperation. The perception is that it can be competitive in nature, and I think we can work through that for the benefit of the patients. Any other questions? Matthew.
So I think, and I'm trying to remember who all was said it. Hang on, guys. I think it was Holly that made the mention at the end about wishing to be able to get the data, in so many words I'm paraphrasing, data back from the SNFs. Can you just elaborate on that a little bit more? I'm a little bit lost in terms of right now, under this arrangement, what data is coming from the SNF back to Aurora?
So right now, what I can see from Bamboo is it pulls information from their ADT, or when they say they're admitted, it goes into Bamboo. Then it comes back to me and says this patient is in your ACO and it went to one of your partnered facilities. Then I can see they discharged home, they discharged to a hospital, but I don't see anything further from just that ADT, whether they admitted, discharged, deceased. That's all I'm seeing at this point. So WISHIN could provide further information from the SNF's EMR, such as notes and medical medications, things like that.
Right now, I mean, to have 30-some Leading Choice SNFs that are a part of us, we don't have access into their EMRs. And they have access into our Epic, but we don't have access into theirs. So anytime those patients come back, what's their, do we get a MAR from them? Do we get the information that we need to adequately care for them in the ED? So, being able to have that look into the SNF's EMR is huge.
And so then I think the follow-up is to Matt. What are you seeing right now is that barrier? What's the biggest barriers to that?
Well, the shortest answer to that is cost. So nursing homes are strapped. They are just lowest on the totem pole for participating in value-based purchasing programs. They're all, and one of the reasons is we just on a different economic reality than nearly every other setting in the healthcare system. So anytime that there's a cost, and there is no cost to participate in Bamboo, Advocate Aurora is completely taking that cost for us and for their partners. So thanks to them for that too. Eventually, once we want to build those, like I mentioned at the beginning, the financial incentives and the contracts that we get a revenue stream that can pay for stuff like this, but we're not there yet. So it's really, really, we're just trying to make payroll. Even the really high quality ones are. And then your first question, just to give you a great analogy, because we work with and implement this with a bunch of different nursing homes. Lauren came up with this great analogy for Bamboo, because they're like, well, what does Bamboo do? And so she called it, it's like an air tag. So then for Advocate Aurora, they have an air tag on that patient when they come into our building or when they leave or where they go. That's the limited data set. And then WISHIN is all the other stuff that we can do. And there's all kinds of exciting things that are available with WISHIN, but I don't know if we have time to get into those. But maybe next year we'll be here and talk about those.
And sorry, quick follow-up, but my understanding, the expense side, the challenge is not the expenses of connecting with WISHIN. Is it having the infrastructure to connect with WISHIN in the first place? Is that the challenge?
Yes and yes. So Steve has done a great job and is offering I won't get into details. Steve can talk about it. but yeah, there's a huge, even with Bamboo, we read into unexpected costs, and it's just so much. It's just more complicated than we wish it could be. There's all, with all these different nursing homes. There's a bunch of different electronic medical records. Some are really good. Point Click Care, shout out to them. They're awesome. Matrix is good. ECS is good too. And there are some other ones that I won't mention.
Archaic.
Well, with that, Matthew, I will add that WISHIN and Davis Clinical Consulting, which is led by Lauren Davis, we have, as I mentioned in my opening remarks, we've partnered to explore opportunities for that data to be reciprocal. They'll consume data, but then we will look at opportunities like through Point Click Care and Matrix Care, ECP, ECS, all of the other three-letter acronyms that exist in the ecosystem to connect. There are cost constraints, and we're looking to work through those in bulk, in mass. How can we go to these vendor organizations and say, what would it cost to do a single hub-style connection? Not all of these EMRs are set up to do such. So we have to be very creative and look to our state partners to help incentivize participation in WISHIN and to help offset the cost. I think that's where we need to go. Again, short term, we are looking to prove out this value equation in a specific region for a specific ACO to then take to those state partners and say, this is how it can work across the state of Wisconsin. Let's adopt something that replicates what has been achieved through the Advocate Aurora ACO with Leading Choice Network, with Bamboo Health.
And just to add to that too, the other barrier outside of cost is just the change management and facilities being open and willing and wanting to change current processes. And so working with WISHIN on the strategic implementation, guidance, or, what we're discovering at these assisted livings and nursing homes is how can we put this as part of their workflow? How can we not disrupt what they're currently doing and build in these processes that it's going to be a challenge. Change is hard no matter what, but how can we make them see that this is easier? They don't have to wait at a fax machine for a referral. They don't have to wait at a fax machine for orders or progress notes. And how can we ensure that when someone's going to the hospital or someone's going to an appointment, the same paperwork is going every time? And with an electronic options, that's going to be the most efficient way possible. Current state, most buildings are faxing or calling information, and they might having to print fax and scan it over potentially 2-3 times, depending on where that person's landing in the hospital system. Maybe one's to the ER, one's to the doctor's office, one's to the floor, wherever in the hospital they're going. So if there's a way that we can do this electronically, and I think that's where my Davis clinical team is really looking and focusing their efforts on how can we make these technology, just make this technology more operational, and especially with transitions in leadership, every time there's a transition, then you have to re-educate and reteach them those processes.
Our goal is going to be to remove those technical barriers. There will be staff barriers, there will be changeover. Printing off these stickers was not an accident. Joe used to, Joe's still here. I'll call him out again. Joe, this is for you, man. I mean, that is our goal. We heard it from Lauren. The way to find the most efficiency is to keep that electronic data electronic. Now, putting on a fax machine and having a ream of paper for nurses to sift through, we can facilitate the seamless exchange between. Somebody has to be first. We're looking to do that through Davis Clinical Consulting partnership to ease that burden, and it's going to take time to implement this in folks' everyday workflow. Any other questions for the panelists? Well, Thank you to Bamboo Health for sponsoring this. Thank you to Gina, Holly, Matt, Lauren, and Chris for being panelists today. Appreciate it.